Like to say good afternoon, everyone. Welcome. My name is Ian Sweeney. I currently serve as the president of the Seventh-day Adventist Church in the United Kingdom and Ireland. And joining with me today in hosting our program is Sharon Plack McDonald, who currently serves as our Health Ministries Lead Director. But as we begin our webinar, I would invite you, if you're comfortable, to join with me in a word of prayer as we begin. Our Almighty God, we thank you for this opportunity to meet together, to discuss, to ask questions, and to look at some of the issues that surround this very difficult health challenge that we face, and particularly with respect to the questions and concerns many people in our community have with regard to vaccines. We ask for your guidance and for your wisdom, and ask that this might be a most productive meeting as we seek for the best health, not only of ourselves, but indeed of our entire community. Amen. By way of background to our webinar, over the years, I have been approached by a number of health charities and organizations who have been working on the behalf of or in conjunction with the National Health Service to help promote or to help health initiatives among the Black, Asian, and minority ethnic community. Due to the fact that the majority of our faith community comes from a BAME background, I have assisted in promotions for blood transfusion, organ transplants, and more recently, I've been approached as to whether I would lend support for COVID vaccine take-up. Now, before we get into that, over time and on a number of issues, the Seventh-day Adventist Church will make statements regarding important issues and our understanding of those issues. So over the years, statements have been issued in regard to subjects ranging from global poverty to ending violence against women and girls. And statements begin their life with a committee of specialists, whether in theology or medicine or ethics, specialists in their field who will, as a committee, draft a statement, and following much discussion, this will then be presented to leaders from across the globe, such as myself, at our annual meetings, which would then be voted upon, discussed, voted, and accepted. And a statement on vaccines was actually voted in March 2015. And this statement reads as follows. So this is a statement that's made, and understand that statements, they're not creeds, they can be changed. But this is our statement, voted in March 2015. The Seventh-day Adventist Church places strong emphasis on health and well-being. The Adventist health emphasis is based on biblical revelation, the inspired writing of E.G. White, co-founder of the church, and on peer-reviewed scientific literature. As such, we encourage responsible immunization / vaccination and have no religious or faith-based reason not to encourage our adherents to responsibly participate in protective and preventative immunizations programs. We value the health and safety of the population, which includes the maintenance of herd immunity. We are not the conscience of the individual church member and recognize individual choices. These are exercised by the individual. The choice not to be immunized is not and should not be seen as the dogma nor the doctrine of the Seventh-day Adventist Church. So for our program and our webinar today, which is about asking questions, and it is more about medical than it is faith-based, But let me just address this as a religious leader. I do not believe I'm going against my faith community in co-hosting and promoting this afternoon's webinar. And in line with our church statement, we are not here to say you must or must not take the COVID vaccine. It is your decision, though we are encouraging you to think about this seriously. Additionally, my faith and belief in an all-powerful God is not in conflict with taking the vaccine, of which I have. Further to this, taking preventative and protective measures, such as wearing a mask, observing lockdown, or taking the vaccine can be considered and is considered, at least by myself, as part of my responsibility to protect others. So in this welcome, I'd want to close my opening remarks with the words of the church leader named Paul, who wrote in Philippians 2 and verse 4, "Look out for one another's interests, not just for your own." And so whatever our actions, let's ensure that they are a contemporary demonstration of our care for one another. This is part of our obligation to God for the life he has given us, and we are to live life in effective service for others. And so by way of introduction, again, we welcome you here, and I now hand over to my co-host, Sharon Platt-McDonald, to give a welcome as well.
Hello, everyone. It's a privilege to be here today, just to share and to co-host this event. And so it's captioned, as you can see there on the screen. I hope it's clear for you. COVID-19 vaccine, separating fact from fiction. That's the goal of today's webinar. And we're hoping to answer your questions. So in a while, you're going to meet the team of health professionals, experts that we have today. But first of all, I'd like to draw your attention to the opening poll. Now, the reason for this is for us to ascertain your views, and you can see the questions there. How likely are you to accept the COVID-19 vaccine? Are you very likely? Are you likely to do it? Are you still undecided? Are you unlikely to take it for whatever reason? Are you very unlikely to take it? Or there is a stipulation there, I have already had the vaccine. Now, what we're going to do, we're going to pause. It should be on the chat as well, for you to take a moment to answer. There you are, that's coming up there. And we're giving you a moment to answer the questions in this first poll. At the end, we're going to repeat this again to ascertain, has views changed, or more importantly, were we able to answer your questions, or were you more informed as a result of this session? At the end, we're going to be inviting Dr. Sherilyn Perry, and we'll introduce her a little bit later on. She will be doing the summation, which means she will be bringing together all the salient points, what the facts were, what the fiction was. And as she brings those together, she will make a closing statement as to what was achieved or what the salient issues were, also incorporating some of your questions and queries. And then at the end, we're going to do some signposting. So I know that a number of you will have a number of questions to ask. We have already identified the health professionals who you can send your varied questions to. And when they present, you will see their details on the slide. And one of those persons will be Dr. Adwo Danso and Dr. Abdul. We also have Dr. Beatrice Castrati from the North England Conference. She'll be available, and Professor Canunga. So just have a look at their screen. When they present their PowerPoint presentation, their contact details will be there. And then those are the individuals whom you can send your questions to after this event, and they will answer them specifically. So I hope that's clear. So I'm going to hand over now again to Pastor Sweeney, who will do the introduction. Have we had enough time to answer the poll, do you think, Pastor Sweeney? And Richard, there's enough time there? Okay, so while we are bringing in the various experts, you can continue with the poll so that we can see your responses. Thank you so much.
Thank you, Sharon. We've got four special guests today, well, five actually, and maybe a few more. And we'll begin to introduce each one of them just by a brief profile. Our first speaker is Edward Canunga. He is a senior public consultant, epidemiologist, and population health advisor for the NHS Hospital Trust and an NHS Mental Health Trust. Previously, he was Joint Director of Public Health and Protection for two councils in the northeast of England for 9 years and has held a number of regional lead roles in that capacity. He's also a Deputy CPD Regional Advisor for the Faculty of Public Health UK, as well as Professor of Public Health and Policy at Teesside University, and serves as a lecturer for the Master of Public Health programs at the University of Essex and the University of South Wales. He's a certified lifestyle medicine specialist and also passionate about health and children's ministries. He's married and has two beautiful children, and they are active members of the Seventh-day Adventist Christian Church up in Middlesbrough. And so without further ado, I'd like to give the time over now to Edward, Professor Canunga, as he makes his first presentation. Thank you, sir.
Thank you, Pastor Sweeney, for the introduction, and thank you for the invitation. And good afternoon, brothers and sisters. I'm just going to share with you a few slides, lots of pictures, because I'm more pictorial than I am in terms of words. So as has been introduced, I'm Edward Canunga, serve in the Middlesbrough SDHH up in the Northeast, and I can be contacted. My email address is at the bottom, and those of you who are active on social media, you can follow me on Twitter. Perhaps just to follow through what Pastor Sweeney has already highlighted, and just to make it very clear, I do not work for any pharmaceutical industry. I work in the NHS and I'm involved in a number of public health programs, but I'm here in my personal capacity. Also, I'm not here to convince people to take the vaccine, but I'm here to help share some information, shed some light, and hopefully people can use that information to make an informed decision. So COVID-19 vaccinations, the World Health Organization has designated that, as well as the pandemic that we are dealing with, one of the biggest public health challenges we have is vaccine hesitancy, or the lack of confidence in a vaccine where it is available. So this is not about places where the vaccine has not yet reached, but we know efforts are underway to make sure every country has got access to the vaccine. But vaccine hesitancy is when the vaccine is available and people are eligible, and for whatever reason, they do not participate in the program. Vaccine hesitancy is an area of public health practice that has been investigated over many years, is not only restricted to the COVID-19 vaccine, but also we have seen that in a number of other vaccination programs. And predominantly with most vaccines, most people would accept. There will be those who accept with doubts, and then there's those who delay, but in the future, depending on what their concerns are, they then move on to the accepting. But I think we need to recognize that there are some people who refuse vaccines for whatever reason. For some people, it is a matter of principle, and for some people, it is a matter of it's going against their own belief and wishes. And usually people who are in those areas, it can be very difficult for them to change their minds. And I think we need to respect that people have got that as their own right to make a decision. So I'm just going to share with you a framework I found very helpful, which is using the acronym of BRAIN. So B is for the benefits. So what are the benefits of taking this course of action? What are the risks? What alternatives exist? What else could I do instead? What is the instinct? What is my insight into these issues? Does this make sense? Does it feel right? And then N, which is nothing. What happens if I don't do anything? So vaccines are nothing new. We know over the years, vaccines have led to significant improvements in population health outcomes. We know very well that vaccines, whenever they're introduced, going way back, they always lead to a reduction in the number of the people with the disease, and in some cases, almost complete eradication, as we have seen with conditions such as polio and smallpox. So that vaccines work is probably not a bone of contention. And the majority of us, myself included, have got a lot of appreciation for vaccinations because we were vaccinated when we were little, and some of these major killers we have then escaped as a result. Again, within the public health profession, there is unanimous agreement that second only to water and sanitation, vaccines are the second biggest contributors to improvements, not only in length of life, but also in quality of life. So when it comes to the COVID-19 vaccine, there are quite a number of vaccines that are now being utilized, and my colleagues will go through this in a lot more detail. But we know from the studies that these vaccines are effective. We know that they prevent severe disease. We know that they reduce the risk of hospitalization, and they do save lives. And their effectiveness ranges from anything between 70% and up to 95%. And we'll come back to the explanation of this effectiveness in subsequent discussions. We know, certainly in the UK, the figures are beginning to show as we see an increase in the number of people who are vaccinated, but Israel was one of the first countries to achieve a big population coverage of vaccinations. And here are three graphs which shows what has happened in Israel. So you can see from the beginning of their vaccination program, they saw a reduction in the number of cases within the vaccinated cohorts. They saw a massive decline in the number of people being admitted into hospital, and they also saw a rapid decline in the number of people ending up in intensive care as a result of those hospitalizations. In the UK, we are seeing a similar pattern, and as you can see, those of you who watch the news will see the daily updates with regards to what's happening in the number of deaths in people who have tested positive for COVID-19. We are seeing a massive reduction, especially in the over 80s, because the majority of those by now are now receiving or would have received their second doses. So we know that the vaccine does work and benefits, and as this is being rolled out across the world, we are beginning to see those impacts and those things that were seen in the trials that were carried out being played out at population levels. So what are the risks? Well, when you look at the major concerns that people have with participating in these vaccination programs are predominantly about safety. Are these vaccines safe? Were they developed too quickly? And actually, what are the long-term effects? We have seen an infodemic where lots of information has been circulated about perceived effects, and I'm sure we'll go back into that in a lot more detail. But we know certainly from here in the UK and in every country, when you roll out these vaccination programs for COVID-19 and any other new vaccines, there is something called the yellow card scheme, and that monitors the seriousness of side effects. And they will collect information on any reported side effect, from injection site pain all the way through to suspected deaths. And each of those are evaluated for their link with the vaccine. And we know so far that not only in the UK, but in the US, that there's been very few serious side effects after millions of jabs have been provided. World over, we have seen lots of people being vaccinated. Each country has got millions of people who who are participating in these vaccination programs. And some of the things that are circulated in the social media, if they were true, I'm sure we would have picked up all of these issues if there were those significant risks. So what are the alternatives? If I decide not to get vaccinated, what are my alternatives? Well, you could say, yes, I'll develop active immunity. So active immunity is when you allow yourself, or when you end up having been infected, and you develop immunity the natural way. Studies are now telling us that that immunity, yes, does generate, but it does not last a long time. Up to 5 months is the estimate at the moment. But we also know that the risk of severe disease, once you get infected, is significantly high. And depending on your ethnicity, it is significantly higher for people of color, certainly here in the UK. So yes, you might decide to take that risk, but it also comes with the risk of severe disease, the risk of dying, and the risk of long COVID. We also know that another potential alternative would be, could I not get the immunity a different way? There is something called passive immunity when you take plasma of someone who has been infected before, obviously manufactured, cleaned up in the medical processes, and you end up receiving that. But we know to date, plasma therapy has not shown the immunogenicity that you require for people to be declared immune. So that one is not an option. Drug treatments, we know there's been numerous drug trials from ivermectin, hydrochloroquine, prednisolone, the use of silver, vitamin C. Again, the evidence base says that they are not conclusive and they do not prevent or treat COVID-19. To date, there is no effective treatment for COVID-19. There are some drugs like dexamethasone that can be used in a select group of patients and result in good outcomes. And some people might say, well, why don't I use supplements? Supplements are good. I am a trained lifestyle medicine specialist. I always advocate for lifestyle rather than drugs. But to date, the evidence base does not tell us that these supplements prevent or treat COVID-19. So that's not to say they're not good. You can carry on taking them, but you shouldn't use them as your excuse or as your lifeline, because so far the evidence is showing that they are not effective on their own in terms of treating, especially severe disease. And the overwhelming evidence is that the infection prevention and control approaches are the best we have at the moment. The washing our hands, the wearing of face masks, and the social distancing measures. That's the only alternative we have at the moment that is robust if you were to compare that with the vaccines. Intuition, I'll come back to that in my last slides. So what if I do nothing? Well, here in the UK, we saw sadly the impact COVID-19 has had, especially on Black, Asian, and minority ethnic groups. We know that the risk of severe disease, severe complications is significantly higher for people of Black, African, and Afro-Caribbean origin, but also the same for Asian populations as well. It can be as high as 4 times greater than the white population. So if we decide to do nothing, then we are accepting to bear that risk, which we know we have seen played out. We know certainly throughout all of last year, we saw these sad pictures being replayed every day on the news. And we saw people who looked like us, and perhaps for some of us, people who are part and parcel of our families or our network of friends. And we saw the disproportionate impact on people of Black, Asian, and minority ethnic groups. And those of us who are in the health and care sector, because of occupational exposure, the risk is greater for us to be exposed to COVID-19. So I'll finish off by just talking about intuition and instinct. As I mentioned before, vaccine hesitancy, it's great that people are concerned. It's absolutely right. And I'm actually, as a public health professional, for the first time, have seen people getting actively engaged in questioning the treatments that they receive and asking the right information. So was I hesitant at first? Of course I was, even as a public health professional. But I looked at the evidence personally for my own self, but also professionally, and perhaps today to help inform the debate and the discussion amongst colleagues. And so on the 1st of January, I was offered my opportunity, and having done the brain framework, I decided to get the Fisa BioNTech, which is what I was offered. It's not like I walked in and I said, can I have that one? I just took what was offered to me. And just last Thursday, I received my second dose. And the only side effect I have so far is my arm, which was a little bit sore, but other than that, I am still okay. So from my point of view, the BRAIN framework has helped me to look at these issues and come to a position. I'll stop there, Pastor Sweeney, and I'm sure we'll come back later for discussion and questions.
Thank you very much. Really appreciate that, Edward. And Sharon's now going to grill you for just a short moment with some. There's loads of questions coming in the chat, but we're going to have a presentation and one or two little questions, and then hopefully we'll have enough time for questions at the end. Over to you, Sharon.
Yes, absolutely. So this is in two segments. 2 questions per presenter, and then in the second session we will have the more elaborate and weighty questions. So thank you so much, Professor Canunga. Now, on the 26th of February, the British Medical Journal highlighted some of the reasons for vaccine hesitancy. And one of the things that they found, as you've said, is the fact that there are more hesitancy amongst people of BAME communities. But one of the things they mentioned was that the hesitancy, we feel, this is the BMJ, British Medical Journal, is down to the fact that there has not been, one of the reasons was not enough public messaging around some of the complications. So for instance, if you go into the government website, you'll see the list of after effects or reactions. And one of the reasons the British Medical Journal is saying that there's hesitancy, that the messaging, the health messaging around what the vaccine does, possible side effects, has not been highlighted enough in terms of some of the negative impacts. How do you answer that?
Yeah, thank you very much, Sister Sharon. So absolutely, I mean, the World Health Organization looks at vaccine hesitancy and uses 3 C's to break it down. So the first C is around confidence. So can I be confident that this is safe, that this is effective, and that this will not harm me? The second one is around complacency. This is when people go, well, yeah, COVID is just like another flu. It wouldn't touch me for whatever reason. And then the last C is around convenience. And this is more about the vaccine is being offered in places where I cannot access, I can't go out of my way. But the biggest concern, you're absolutely right, certainly here in the UK, where we have seen the number of people affected by COVID. So complacency, perhaps in most communities, is not an issue. The issue regarding convenience, again, is not an issue. We are seeing the vaccine being rolled out in many different areas. The main issue is around confidence and trust. So can we really trust that what we are being told is the truth? But at the same time, we've got parallel communications that are happening. We live in a world that is perhaps more connected than it was many years before. The World Health Organization is talking about an infodemic. We are witnessing lots of information being circulated, some which is actually being described as coming from authoritative sources. So I know, and I've spoken a number of times about information disorders, which range from misinformation, malinformation, and disinformation. And all of those are different. And sometimes people have got an intent to cause harm by circulating information that is not accurate. So you're absolutely right. I don't think collectively, certainly here in the UK, we have done enough to restore people's confidence and to give them the authoritative information regarding the vaccination. And I'd like to congratulate our own union conference for this session, because this is one of the ways of getting the information across, not to convince people, but at least to balance it out so that people can make the right decisions. And I hope that this is not the only session, and we'll plan to run them in the future.
Yes. So a follow-up, thank you so much. A follow-up question to that. Another key area around hesitancy has been informed consent. Now, a number of health professionals who've contacted me have said that, for instance, one young lady who's a health visitor, she said, Sharon, when I vaccinate the babies, I explain to the mothers exactly what is in the vaccine, and they know exactly what to expect. Now, later on, we're going to break down in detail the contents of the AstraZeneca and the Pfizer. However, what we're finding is that people are turning up to get their vaccines done. They come home waving a bit of paper. After that, they're seeing what's in the vaccines. Why is it that there has not been enough informed consent, people actually being told the vaccine contents to engage them? Because people are concerned that they've just been given the vaccine, then they're finding out later on some of the controversial contents in the vaccine.
Yeah, thank you very much. I mean, a vaccine is a clinical procedure. It is delivered as part of a clinical intervention. And we need to empower our communities to say it is within your right to ask before you participate in any medical intervention. And vaccines are not an exception. So it's not a matter of you turn up, you roll up your sleeve, you get jabbed, and then you read the leaflet afterwards. Please do ask for that information before the vaccination. It is well within your right for whoever is giving you the vaccine to explain to you and for you to sign off your consent on the basis of understanding the information.
Lovely. Well, thank you so much. We'll come back to you later, Professor Canunga. But now I'd like to introduce our next speaker, who is Dr. Adwoyi Danso. And Dr. Danso is a GP in London, and she studied at Barts and London School of Medicine and Dentistry. And Dr. Danso currently serves as a board member of the Ghanaian Doctors and Dentists Association UK, which promotes health and well-being amongst the Ghanaian community, both in the UK and in Ghana. Now, she's also a resident doctor, a GP on the GN Radio UK, and works tirelessly to promote community health awareness alongside shining a light on medical discrimination on her social platform, the Clinic Diaries. And she's been awarded for her work at the National BAME Health and Social Care Awards. So Dr. Danso, we are privileged to have you with us today. The time is yours now for your presentation for up to 7 minutes. Thank you.
I'll try my best to stick to time. So I'll just introduce myself. So I'm Dr. Adwoyi Danso. I am a GP working in the NHS as well as the private sector. I think it's just important to say that, you know, I'm here to spread information. I haven't been coerced to be here. I'm not getting paid to be here. I just think it's important to sort of serve my community. And I've also been privileged enough to work as the clinical lead at the local COVID centre in my area. So I'm just going to share my screen with you now. Yeah. Is that all okay? Can you see that okay? Okay, great. So I will be talking a little bit more about vaccines. I've described it as finally the beginning of the end, you know, because this has been a year, almost a year to the day of our first national lockdown, and we are finally beginning to turn the corner. So I think some of this has already been said, but, you know, why do we need a vaccine? Ultimately, we need a vaccine to protect us from dangerous diseases and also to protect not just ourselves, but the vulnerable people within our community, young children, babies, as well as elderly people. And essentially, it does reduce the long-term effects of disease. And like we are seeing with COVID, it's the most effective health intervention. Without a vaccine, it's likely that we would have seen more deaths, we would have seen more complex needs, and it's the thing that has allowed us to kind of move forward. Now, we already have vaccinations in place. Polio vaccine exists in this country. Unfortunately, in other countries, and you can see in the top right corner, this is the effects of polio. If you are to have polio virus, it affects the muscles, it causes weakness, and it leads to paralysis. Unfortunately, in the UK, we have a vaccination scheme at a very young age to protect young children from this, because it's completely preventable. And if you have children, or you might remember this red book in the side. Again, we have vaccines for MMR, lots of different things that we give our children to protect them, because there are long-term complications. For example, mumps could be pretty harmless for some children, but other children have complex complications such as deafness, such as infertility for young men. And it's, again, completely avoidable. Yellow fever vaccine. As you probably know, I'm from Ghana. I travel to Ghana often, and as part of the requirement to go to Ghana, you need to be vaccinated for yellow fever. So again, these are existing vaccines that we have and we use regularly. And healthcare workers, as a prerequisite to starting work, you are required to have a hepatitis B vaccine. Now, we cannot talk about vaccinations without describing hesitancy. Now, it's important to distinguish between hesitancy and outright rejection of the vaccine. Hesitancy essentially means you're unsure, you're undecided, you want time. So it's important to always remember that. And I've just put a couple of pictures just to kind of talk a little bit more around that. Now, the top left picture here, I'm not sure if you can see my cursor. This is a picture taken from the Tuskegee trials in America. Now, some of you may be familiar with that, some may not, but essentially it was a trial to look at the progression of syphilis, and the majority of the participants were Black men. Now, the issue was, on the discovery of penicillin, which completely treats syphilis, the cure was withheld from these participants, and it was a completely unethical trial. And this plays really heavily on a lot of people's minds. And the most shocking thing is this trial took 40 years and it ended in 1972. It was not long ago. If we look across to this 5 More picture here, I'm doing a lot of work with 5 More. It's an organization that works to safeguard women. Black women are 4 times, at the time of this, it was 5 times, 4 times more likely to die in childbirth than any other group. That's a startling figure. Again, you have to understand, in order to vaccinate, you have to understand where hesitancy comes from. And this is something that we have to keep in mind. In the bottom corner here, if you can see my cursor, there were 2 French scientists at the start of the pandemic who were talking about a completely separate vaccination program, who actually said on TV, national TV, we should go to Africa and test these vaccines on Africans. African people are not lab rats. But again, this goes so far to cause hesitancy, to make Black people feel as though we're guinea pigs. So we have to understand as healthcare professionals as well that this is where it all comes from. And then we look at the nursing standard, this headline. Mary Ajapong, some of you may be familiar, a nurse who was pregnant who died, possibly from the consequences of being at work. There has been an inquiry lately, most recently, and it's been revealed that she was actually pressured to go to work. She actually presented, she was short of breath, and she was told that she needed to go home because her observations were actually normal. And she was very unhappy to go home, and she died. At times, our concerns are not taken seriously. And then finally, WhatsApp. I put the icon on there. I think many of us actually do use WhatsApp. Now, WhatsApp is, how can I describe this? During the height of the pandemic, or even at the beginning, there were so many messages with different conspiracy theories, different theories that were circulating so fast. And it wasn't just from people who were not aware. People who were very aware were also sending these messages. But we have to understand, why is it that people feel more safe in trusting a WhatsApp message than what the government is saying? You have to ask yourself that question. Why is that? Because of the mistrust that exists within our community. And it's not just in healthcare, it's also in the educational system, in the judicial system. We see it everywhere. Anyway, as we move forward, Public Health England have actually released a report looking at the disparities that exist within COVID, and actually looking at why Black, Asian, minority ethnic groups are most affected. And they've published this report, and they actually do mention racism as being a factor. It's a huge factor, and I think we cannot ignore this. But we have to also realize that as Black people, as a Black person that I am, for example, we are the most vulnerable. So we don't want to continue that cycle that's been perpetuated. We actually have to use all the resources in front of us to make a decision to protect ourselves. So currently, we have a vaccine schedule in the UK. The vaccine is based on is given to people who are in the most vulnerable categories first, because ultimately these are the people who are more likely to do very, very poorly from COVID, the people that are more likely to require ITU admissions, the people who are unfortunately more likely to die. So we're looking at this list here. Depending on the area, we're probably around group 6, 7 at the moment. That's where we're working in the area that I work, but this can vary from place to place. Now, interestingly, as I've mentioned before with regards to disproportionality, so we could see that Black people, actually Black Africans, are more likely to do very poorly from COVID. But looking at this priority list, I do not see any prioritization of Black people. So it's very difficult to kind of understand. So we have been told that we're most vulnerable, but also we're not being prioritized. And most recently, however, this has been acknowledged, and we are including that in the risk calculation now, ethnicity. So those people are going to be contacted to come and have the vaccine too. The other question that we're commonly asked is with regards to the when is my turn to have the vaccine? And it's sometimes quite difficult to predict, but if you use this calculator to the right here, you should be able to predict roughly when your vaccine will be, which is quite helpful for some people, because I think sometimes not knowing also causes anxiety too. So which vaccine? There are lots of different vaccines. And currently in the UK, as mentioned previously, we are using Pfizer and Astrazeneca vaccine. Now, I have to speak very honestly, I have had both of my vaccines. When I went to have my first vaccine, I was completely unaware as to which vaccine I was having. Now, I had researched both of these vaccines. I was also quite nervous, admittedly, but I also understood the risks as well. I've seen people who are younger than me, people who I've worked with, who had no pre-existing medical conditions, end up in ITU, and also some have unfortunately died. So I know that sometimes it's not easy to always predict your risk. So I made the decision that I was going to have the vaccine because I realized that either the Pfizer or the AstraZeneca vaccine would reduce my risk dramatically. It reduces hospitalization, so those that require ITU admissions. It also reduces death rates, and it also reduces severe COVID. So what we don't really see actually are the people that have come out of ITU, that have come out of serious COVID admissions, who are actually requiring long-term oxygen, who are actually having complications as a consequence of being completely septic. So the infection has spread to their whole body. So I realized that was something that I wanted. I wanted to protect myself and also my close immediate family. So both vaccines do that, and that's really important to remember. Now, the Pfizer vaccine. So this is actually a slide that I made that's actually on my Instagram page as well. And I made this fairly early. So this is just basically showing you a little bit more about the Pfizer vaccine. Now, the Pfizer vaccine is a newer technology, which is why it's slightly more expensive. People always ask, why is Pfizer so expensive? Well, it uses a newer technology. And the most important thing about Pfizer is the storage. The storage requires a fridge that goes down to -70 degrees. And most fridges that we use in normal GP surgeries, we do not have that temperature. So it requires an extra facilities, which costs more. And you get about 95% efficacy of preventing serious disease after the second dose. Now, we are currently having doses 12 weeks apart in the UK as well. And we actually are starting to see that it's actually more effective because it wakes up your immune system and it gives your immune system time to filter out the antibodies that are not doing so well. So you actually have really, really strong antibodies ready for that second dose, and they boost all the strong, powerful ones, which really do protect you. The AstraZeneca vaccine uses more classical, traditional types of vaccination. We are seeing about 90% as well more recently with newer studies that are coming out. So about the same, quite truly. And actually going back to the Pfizer, and I think Professor Canunga actually mentioned, there was a really big Israeli study which has actually showed that it reduces transmission, which is exactly what we need. So not only does it protect, but it's reducing the chances of transmission to other people. AstraZeneca. Now, we can't talk about AstraZeneca without talking about the most recent press about blood clots. And I'm sure this may be mentioned again later, but I have to just stress that perhaps, is this a political move? I don't know, but also the risk of you having a clot after an AstraZeneca is lower than if you were to go on a long haul flight. It's lower than if you take the combined contraceptive pill. It's lower than if you are sick, after pregnancy. So I think that's also important to bear in mind too. Now, how do you want to book your vaccine? So the great thing is now we have lots of different ways that you can organize having a vaccine. Majority of people will have their vaccine via their GP. So you will receive a text or a link asking you to book this, or you'll be directly booked by your GP. Some have their vaccines through work. So those that work within the healthcare profession, for example, it's organized by their work. And then the third thing, which is really fantastic, is now you can book your COVID vaccine yourself online. So if you're in this criteria, you can use the service. And if you need the link, I'm happy to share it with you later. And you can actually book more locally. And these are all steps that have been taken to try and improve the uptake for people as well. So yes, that's everything. So those are my details. So I'm on Instagram at the Clinic Diaries. I'm happy for people to send me a message, or you can email me as well, drdanso@theclinicdiaries.com, if you have any questions at all. People do sometimes feel afraid to ask and prefer to email. So I'm more than happy for people to email me any questions or queries. Thank you.
Thank you very much, Dr. Danso. It's time is rushing by, so I'm going to just ask you one question. It reverts right back to the beginning of your presentation, where you said, you know, vaccines, you believe, are, and this rollout, the beginning of the end. So I'm going to ask you this question, very simple. Is COVID-19 going away if we all get vaccinated, or are we with this thing for the long term?
I think that's a really hard question to answer, but I'll tell you something. Viruses mutating, that is normal. We expect viruses to mutate and to change. But what is not normal is the number of people that are dying, the number of people who are having long-term consequences. We already have the flu vaccination once a year. And that actually prevents the severe admissions of people having serious pneumonia that requires oxygen therapy, for example. So we already have this in place. It is something that we may have to consider having a booster jab. I've seen something lately today about perhaps we may have to have booster, but ultimately we have to remember it's not just that. It's protecting people against death and serious complications.
Thank you very much. There are so many chats, and I know going on in the chat section, and we appreciate that. We will try to get to some of your questions. If you have no family members or relatives or friends, what have you, who want to be a part of this and see what's happening, you can just go onto YouTube. Encourage your family, use WhatsApp for a good purpose, go on there, encourage them to go onto YouTube, Google, just in YouTube, BUC News, not BBC, BUC News, and you'll see the live coverage. And of course, people can watch that again. I'll hand over to Sharon to introduce our third speaker.
Fantastic. Thank you so much, Dr. Danso. We'll be speaking with you again shortly. Now, our next speaker is Dr. Beatrice Castrati, who currently works as a North England Conference Health Ministries and Possibility Ministries Director. And she graduated from medical school in 2006. She has been working with ADRA since 2010. She's leading in ADRA various health and educational projects. And she is also Director of Adventist Family Clinic, as well as Director of Health and AVS for the Albanian Mission. So she comes well-rounded with a lot of background. She also has a public health degree or a master's degree rather, in public health from Loma Linda University. And her passion and calling is for health education and health evangelism, and just witnessing for Christ through health ministry. So welcome, Dr. Castrati. The time is yours now for 7 minutes. Thank you very much.
Hello, thank you so much for the kind introduction. I'm very happy to present, and let me share with you my presentation, and I hopefully will run you through in time. So I'm going to talk more about the faith aspect and the religious aspect about what is going on. So I'm going to talk about the gifts of grace and, of course, guidance versus gossip. So what are the gifts of grace? They are actually our core values. God has given us the gift of discernment, as we can read in 1 Corinthians. He has given us the gift of wisdom, as we can read in the letter of James. He has given us the gift of love for each other, which is so important if we read the love chapter in 1 Corinthians 13. And of course, he has given us the gift of unity. All gifts are by the same Spirit, by the same God, and unity in diversity. And of course, most importantly, he has given us the gift of humility, gentleness, and patience, as we are seeing in the letter of Ephesians. So what are the core values that we identify for our work and that I have identified for health ministries? And of course, it is outreach. It's value-driven. It's evidence-based, progressive. We want to promote kindness, respect, inclusivity, and equality and integrity. Now, we see here two core values that seem to contradict each other: scripture foundation and evidence-based medicine. But do they really contradict each other? And do they not rather complement each other? So if we just compare, what is evidence-based medicine actually? It is trial and error. And trial and error is a scientific approach. The most elementary and valuable statement in science is actually the beginning of wisdom. It is the statement to say, I do not know, I want to know. So through testing and evaluating, we gather evidence, and a theory is either proven right or wrong. That is trial and error. So if we read up in scripture, we compare in Leviticus, what is happening there. Leviticus 13, for example, a suspicious skin rash, the priests were told by God to shut the possibly infected person away for 7 days and then examine him or her again. So there we have trial and error again. Further evidence in, again, the evidence-based medicine approach is gathered to consolidate the findings. What does scripture suggest? Consolidate the findings again. If the outbreak had not spread to other areas of the person's body, then they were to be shut away for 7 more days, even more consolidation. And then after the consolidation of the evidence, action is being taken. So again, in the Bible, if after 2 weeks the outbreak had not spread, then the priest would release the person and direct them to wash their clothes and pronounce them clean by the priest. This is a biblical approach. Again, we see in Judges, one of my favorite books of the Bible, to be honest, a theory is posed and evidence is gathered to prove or disprove it. What did Gideon do? Gideon asked God for a sign. We all know, we are familiar with the story. He asked for dew on a fleece of wool, but not the surrounding ground. But what did he do then? He was not happy with just this one piece of evidence. So after the evidence was gathered, he wanted to have a different perspective and a different approach, and again, consolidate the findings. So Gideon asked for a second time. And what happens in evidence-based medicine? Continuous monitoring ensures that research and action plans are on the right track. And again, Gideon continues asking for many signs after that. And important, he is granted his request every single time. Scientific approach to find evidence and to consolidate evidence is actually a biblical principle. So God appreciates and values the honest search for truth and provides evidence for those that are truly open to listen to his answer. We heard our previous speakers say, it is good to question things. It is good to scrutinize things, because this is what the Bible tells us to do. But what are we actually trying to achieve? And I do want to work a little bit here with our core values. Are the core values actually portrayed in what I'm doing and what I'm trying to promote? And the core values are, am I uplifting Christ through my message, through my questioning, through my public profile, through WhatsApp messages? Am I uplifting my fellow brothers and sisters? And here it is important to ask ourselves, who are my fellow brothers and sisters? Are they my fellow church members? Are they doctors, nurses, my healthcare workers? Are they my own family? Are they friends? Are they my neighbors out there? So am I doing what I'm doing to uplift them or to disparage them? And of course, important, am I using scripture and spirit of prophecy writings the way the Holy Spirit would want me to use them? Am I praying before I am quoting the Bible for my own ends? I want to share with you the World Church position, the General Conference position, and you can also read that up online. Of course, the pandemic has led to misinterpretations of the Bible, such as the upcoming vaccines will lead to the application of the mark of the beast. However, GC is very clear. The Adventists hold the conviction that this controversy will center on the law of God and on the fourth commandment. And Seventh-day Adventists understand the mark of the beast to be not a literal mark. So whatever we believe, having a microchip implanted or taking the vaccine as a pledge of allegiance, that is a misinterpretation of scripture. Such speculations are dangerous. They bring the work of God into disrepute and cause confusion among sincere and less informed believers. And of course, they will add to vaccine hesitancy, unfortunately. So using the vaccine to stir up a scenario of spiritual and cosmic proportions, or to oppose the vaccine on the basis of a faulty interpretation of scripture that only distracts sincere believers from the real prophetic issues and the Adventist Church's commitment to proclaim the gospel, to uplift Christ and to uplift our fellow man. So the vaccine will hopefully protect the lives of those who still need to know about the gospel, as well as those who have already accepted the gospel and are charged with the proclamation of God's infinite love to a suffering world. God does not want suffering. He wants us to end suffering. We can stop the spread of misinformation. We have a voice. We can actually question our sources. It is so important to stop this chain of endless WhatsApp videos that are forwarded many times. We can actually decide not to send unfounded rumors to a group chat. We can decide to get trusted sources instead of sources that we cannot trust. We can double check our facts. We can ask the person who is sending us dodgy videos where they have their sources from and what is their motivation. This is in our hands, and this is how we can stop the infodemic, the pandemic of misinformation. And it is important to understand that in every lie and every misinformation, there is a little bit of truth just to make things even more confusing. So a professor here from the University of Manchester, he said, conspiracy theories have telltale traits. They tend to be circular in their reasoning. They frame events as the result of a deliberate, intentional plan rather than the results of complex forces. We all have heard of the term plandemic, which is, of course, very damaging to any information that is being passed on. So they divide the world into black and white, good versus evil, the government versus the normal person. They rely on dubious forms of evidence and at the same time, unfortunately, discredit the credible sources and the official sources. Unfortunately, there's often a kernel of truth, and even those kernels of truth wind up wildly exaggerated. And again, we find this has happened in the Bible before. The Apostle Paul warns us, such people are false prophets, deceitful workers, and they masquerade as apostles of Christ. And no wonder, of course, Satan himself masquerades as an angel of light, in the words of the Apostle Paul. I want to show this to you because this is exactly what I'm talking about. This was sent to me kindly by a concerned brother in faith, and I want to show to you what this means. Probably you have seen this, and it looks shocking. It's terrible. I'm showing you the lies, and I'm showing you the truth. This is true. These numbers are part of the yellow card reporting system. Professor Canunga has already mentioned the yellow card system. That yellow card system reports literally anything at all that is in any kind of timely context with the vaccine. And that could be ear congestion, that could be vitamin deficiency. It's anything at all that people report on their phone app. However, those numbers are not clinically founded, they are not investigated. Those numbers just flag up what might be of concern and which will then be investigated, but these numbers are not in any connection yet with the vaccine. So we see here a big fat lie. If you turn up the light of your screen, you can probably see how this logo has been pasted into the black background. You can actually see the difference in the background here. So this is not an official government message here, obviously. Death and injuries, very lurid words here, but they're not true. Those are deaths and conditions that have been reported that are not in connection with a vaccine, not in a causal relationship at all. Research and analysis, I leave that up to you. I'm doing my research and analysis on Google and YouTube. I don't know about you, but that is probably not the right way. Adverse reactions, again, reactions that have nothing to do with the vaccine, but that have just been flagged up by that yellow card reporting system. And of course, yes, it's a weekly report that is issued by the government. The government is transparent, it is sharing information, and that is a good thing. Sometimes it is sharing things that, again, we do have to take with a grain of salt because, again, they're in a timely relationship, but not in a causal relationship to the vaccine. So again, let's check our core values. What am I trying to achieve with sending a poster that I just showed you? Am I uplifting Christ with this? Am I actually helping to promote the health message that is given to us in the Bible? Am I uplifting my fellow brothers and sisters? And yes, am I uplifting my fellow presenters here, health experts, professionals? Am I uplifting them? Am I giving them credibility by trusting them? And am I, of course, using scripture and the spirit of prophecy writings the way the Holy Spirit would want me to? And of course, lastly, am I showing duty of care to my fellow man, to my neighbor, to my member of church, to anybody in my family? We are driven by love and duty of care. We must do everything to keep each other safe and prevent suffering. And we know COVID has caused a lot of suffering in the church. The decision about getting vaccinated is not about me. It's not about keeping myself safe. It is about keeping others safe. When I take the vaccine, I decide to protect my neighbors. This is the important takeaway message here. And of course, it is found again in scripture. What does Paul urge his fellow church members to do? That your love may abound more and more in knowledge and depth of insight, so that you may be able to discern what is best and may be pure and blameless for the day of Christ. We can, of course, ask God for wisdom and discernment. We have numerous examples in the Bible of many, many people who asked for wisdom, and God will give it to us. He has given us the answer already to end this pandemic. He has made it possible for information and guidance to be accessible. And of course, he has given us not a spirit of fear, as many want to make us believe, but of power and of love and of a sound mind. Please bear in mind the spirit of a sound mind to check our sources. So the prayer is to not conform to the pattern of this world and test and approve what God's will is. Thank you very much for this. Again, you have my contact data. I'm happy to answer any questions that might come along, and I hope I stayed within the time limits.
All right, thank you very much, Dr. Castrati. I think you went a little bit over, but nevertheless, we're forgiving here. Just one question before we bring in our fourth speaker, and I know there's a lot of discussion in the chat, and you've spoken about vaccines and faith. If somebody presented themselves to you and just said, out of conscience, I do not believe, or I believe that God has said to me, I should not take any of these vaccines. Now, you know, they've said that's what the Lord has shown them. Well, what would you tell them, Dr. Castrati?
I am not their conscience. If nobody is as blind as somebody who does not want to see. So to be honest, I can only urge to look out for their fellow men. I can ask what drives them, what is behind that statement, what are the reasons for vaccine hesitancy, as we have already heard. So I can try to understand. I have to respect and tolerate, but I do not have to agree.
All right, thank you very much. I'll hand over to Sharon.
Thank you so much, Dr. Castrati. Now, our fourth presenter is Dr. Abdul Zubaru, and he's a GP in Southport, Merseyside, and he's passionate about empowering people to improve their own health and well-being. And he's appeared on The One Show and has undertaken several health events for the community so far. Now, he's going to be speaking to us on the COVID vaccine common questions. And immediately after his presentation for 7 minutes, hopefully we will be able to open and really start to answer some of the questions from the Zoom chat, and then we will go through the segments of questions that people have brought in. Dr. Abdul, the time is now yours. Thank you.
Thank you, Sharon. Thank you. It's a pleasure to be here this afternoon to have an important conversation around the COVID vaccine. I'm just going to share my screen for you all. Great, thank you, everybody. As Sharon's just highlighted, my name's Abdul Zubaru. I'm a GP from Southport. I've been a doctor now for 15 years and a GP for the last 10 years. As Sharon has highlighted, I am passionate about vaccine hesitancy. I've written on this subject and also been fortunate enough to be on TV talking about the issue. It's fair to say that I am pro-vaccines, but I'm not here in a capacity to coerce anybody into having a vaccine, hopefully just to provide information so that everybody can make their own decision regarding that. So this afternoon, I've been tasked with providing some information about some of the common answers to some of the common questions about vaccines and health conditions. I'll try and tackle some of the myths and misconceptions around the vaccine as well. So first up, fertility and pregnancy. There's lots of questions that I'm seeing in clinic from women of reproductive age about the safety of vaccines on fertility. The British Fertility Society have actually stated there's no evidence or no even theoretical risk that vaccines can affect fertility of women or men. The vaccines are designed to teach your body to fight off the disease, and the components actually leave your body within a few days. Pregnancy. So pregnancy is slightly different. When you do any clinical trial or you do you trial any medication or vaccine, there are certain groups of people that are excluded from trials, and it's fair to say that pregnant women were excluded from the trials. So it's not to say that the vaccine is not safe in pregnancy. It's just that there isn't the evidence to say that it is safe. Initially, the advice from Public Health England was that don't have the vaccine if you plan to become pregnant within 3 months. That evidence or that advice has been revised, and they now say that people shouldn't have the vaccine if they are pregnant or if they are pregnant. There is an exception to that, and the exception to that is if you are at high risk of catching COVID or you suffer from any clinical conditions that put you at high risk. So a high risk individual may be a healthcare worker, high risk conditions I'm going to talk about very, very shortly. So this looks at underlying health conditions and your risk of having a serious or severe outcome from COVID. Adults from any age with certain underlying medical conditions are at increased risk from dying from COVID or ending up in hospital. This data is taken from the first wave of the pandemic and looks at pre-existing medical conditions and your risk of dying from COVID. You can see here that cardiovascular disease is a big predictor of mortality, along with diabetes and other health conditions. Dr. Dancer went through the priority list for COVID vaccines, and you will remember that people in group 6 are these types of people. So these are people aged 16 to 65 who have been prioritized for the vaccine because they are at higher risk. So I've seen a lot in the chat about keep good immune systems, supplements, and there's a lot of talk about vitamin D in particular. And it's a really interesting topic as to whether or not vitamin D can help prevent or even treat COVID. The UK government's advice before COVID was that everybody should take a supplement of vitamin D between the autumn and winter months to maintain muscle and bone health. There was a study done in 2017. It was a large study which looked at the effect of taking vitamin D on respiratory tract infections. And it showed that there was a modest benefit if you took vitamin D in terms of preventing respiratory tract infections. Various bodies have got together, Public Health England and NICE, and have looked at it and said that more research is actually needed. The NICE guidelines for vitamin D have recently been updated, and they say that people should consider taking a vitamin D supplement throughout the year if you are high risk. So you're high risk if you have little or no sunshine, if you're often indoors, if you have black skin, or you wear clothes that cover your skin. The advice is also added, and they say do not offer vitamin D to people to solely prevent COVID-19, and also do not offer vitamin D to people to treat COVID-19. So that's where we are currently. There is no strong evidence that vitamin D will stop you getting COVID or treat COVID once you've got it. So some of the other questions that I'm getting on a daily basis in surgery. I've had COVID, do I need the vaccine? Yes, it's fair to say that you do get a degree of immunity from infection, but that immunity is definitely variable, and we do not know how long it will last. Vaccination is likely to augment that and will probably provide greater immunity than from just normal natural infection. Can I still get COVID after having the vaccine? Yes, the vaccine is not 100%. No vaccine is 100%, so there is a small chance. It also takes 3 weeks for immunity to build up after having the first dose of a vaccine. So there's possibility of infection after the first dose. I'm low risk, so I don't need the vaccine. Yes, you may be low risk, but that doesn't mean no risk. And there is still a potential possibility that you can become unwell from COVID. And actually during the second wave, we saw younger people in their 40s who ended up in hospital requiring further support. The other aspect that I'm seeing more of is a phenomenon known as long COVID, where people are quite debilitated for months after infection. They get symptoms of tiredness, breathlessness, brain fog, and it's thought now that probably about 1 in 10 cases of infection from COVID can lead to long COVID. So for that reason, again, it's advisable to think about the vaccine. If I decide not to take the vaccine, it doesn't affect others. I think that's probably not true. I mean, to end this pandemic, we've talked about herd immunity, so we need a large proportion of the population to be vaccinated. I think by vaccinating yourself, you are protecting yourself, and then you're also protecting those around you as well. I'm just going to talk a little bit about some of the myths and the misconceptions, and some of these have been covered. So meat products. The vaccine doesn't contain meat products. It doesn't contain pork. It doesn't contain gelatin. It is compatible with all faiths. Claims that the vaccine contains microchip or any other tracking device are completely false. The scientists that created the vaccines want to produce something that saves lives and not monitor your movements, really. Your mobile phone will do a better job of that. The vaccine cannot and will not alter your DNA. The Pfizer and the Moderna vaccines are mRNA vaccines. This has nothing to do with DNA and doesn't interfere with your genes. The last issue is alcohol, and the Astrazeneca vaccine contains negligible trace amounts of alcohol, no more than you would find in bread or in a banana, for example. The British Islamic Medical Association have released a position statement recommending the vaccine. So I think there's some myths, and a lot of these myths have led to a bit of vaccine hesitancy that other speakers have talked about. And we know that vaccine hesitancy is more common amongst the younger population and sort of ethnic minority individuals as well. Just to finish, I'm going to show you a short video of somebody who had the vaccine last month.
Over 75, and I just had a COVID vaccine a week ago, and the results of it, I am asking all VAM folks to embrace this vaccine, and when your turn comes, please accept it and take it. The reason I'm saying this is because there's a lot of scaremongering amongst us blacks, and we need to take it to protect our families, ourselves, and our families, friends, and the community.
So that lady is really valued, appreciated, and really respected. And that lady is my mum. She had the same worries and fears that it's really natural to have for any vaccine, any medication, any treatment. But what she did was she put herself in the best position to make an informed decision. And she had the vaccine, or the first dose of the vaccine, last month. And that's all I would urge. Please get your information from trusted sources so that you can make an informed decision. Thanks.
Thank you very much, Dr. Zubairu. Very interesting. And I just wanted to ask you something in connection or relationship to what you had said. And you had mentioned, I think it came up in the chat, about affecting DNA. The vaccine could affect DNA and so on. And because it's been produced, we would, as I understand it, to be so quickly, can you be sure that it isn't doing any of those things? Or what assurance or evidence do you have, I should say, that it doesn't affect our DNA, and that it hasn't been produced so quickly that, 10 years down the road, we might be growing a third head or something? And I don't say that, I don't know. What would you say to that?
Yeah, I mean, it's fair to say that mRNA technology is fairly new in terms of vaccines, but we do know a lot about mRNA technology in terms of treating other things, in terms of treating cancer. And mRNA is messenger RNA, and it enters the cell. The nucleus of a cell contains the DNA. mRNA does not enter the nucleus, so will not affect your DNA. And also the fact is that the mRNA will leave the body very shortly afterwards, so that there will not be any lasting effects.
All right, thank you very much. Now we're coming to, we are going to finish at 4 o'clock, but there's so many questions that have come up in the chat. I know, Sharon, I know you also have a special guest that you may want to introduce us to, but panelists, please don't leave. We're gonna, you're going to be fired at somewhat with questions and so on. But Sharon, I'll hand over to you. Maybe you want to introduce.
Thank you so much. Now we have less time than we had hoped, but I'm going to pose most of the questions to the AstraZeneca vaccine, because as you can see from the screen, I'm I'm hoping you can see. As you can see, oops, let's go back to this. From the screen, the majority of vaccines that has happened so far in the UK has been the Astrazeneca. And so therefore we had more questions based on that. Now I'm going to ask all those who are viewing on the Zoom and YouTube to take a picture of each of the screens. We're going to look at vaccine, efficacy, safety, reactions, content, ethical issues, vaccines and faith, and vaccines and issues of liberty. We're not going to be able to go through all the questions. So if you take a picture of the screen, you can then field these questions to the professionals at the end. And Pastor Sweeney, after I've asked 2 or 3, will then pick up on the Zoom chat. Right, so one of the questions on the efficacy for any of the panel members, and I think to move with time, we'll just ask one panel member to answer each question. Do these vaccines do what they're supposed to be doing to prevent infection and onward transmission? That's the first one. And then number 4, what is exactly the purpose of the vaccine if it does not protect against contracting or spreading of the virus? Some quick responses. Does it prevent infection and onward transmission?
Yes, we've said that already. It does. There's a large Israeli study that has shown that it reduces transmission. So yes, it does.
Okay, let us go on to the vaccine safety then. Pastor, did you have anything under efficacy because there are a lot of questions. We had about 100 questions on each of these, and people felt that with the government looking at when the trials were done, it was done with the same vaccine 3 weeks apart. And that gave 95% efficacy for the Pfizer, 93% efficacy for Moderna, 92%, up to 92% for the AstraZeneca. But now they're doing the vaccines 12 weeks apart with the second dose. There has been confusion around how much protection it does give because the trials wasn't done on 12 weeks apart. So that's why that person wanted me to ask that question again in terms of efficacy there. Let's move on then to vaccine safety. People are concerned that the vaccines have been produced too quickly. It usually takes 10 to 15 years to develop, but this one was done under 10 months. They are concerned that the vaccine trials are still going. And one of the questions was none of the vaccines are going to be completely, the trials are complete until 2023. So as such, if you really think about it, people are saying we are guinea pigs because the experiment is still good. They feel it's an experiment. These are some of the questions that the trials are not complete. It's still ongoing. So should we not have waited until the trials are complete then to say, yes, it's safe, because there's not enough long-term analysis that would have been done in previous studies. There's not enough long-term evidence to say it's absolutely safe. Any responses?
So I think the vaccine, it has been trialed on the usual numbers of people that it would usually be trialed on. So the AstraZeneca vaccine was trialed on 40,000, the Fisa vaccine 30,000. So they are large amounts of people that it has been trialed on. We're in the middle of a pandemic. We don't have 10, 15 years to wait. The majority of side effects that you get from any vaccine occur within weeks of having a vaccine. So we do know that from people, they've had 30 million people in the country that have had it. So we do know, we've got some really good evidence that the vaccine is safe and people are not getting side effects to the vaccine at the moment.
Yeah, so that's evidence in the short term. I think people's questions were, we don't still know what the long-term effects are. Pastor Sweeney, do you have anything on the chat that's come in under vaccine efficacy or vaccine safety? Can you unmute? Can you unmute, Pastor? We can't hear you.
Yeah, not at the moment,
Please.
but I just want to stick, if you don't mind, I want to stay with this. It's been produced too quickly. And, for those of you who are in my age group, there was a drug back in the day, and I don't even know what the drug was for thalidomide, and of course it had a devastating effect on children born later on to their mothers and so on. And just on this, is this thing come around too quickly? Is it a case of technology in the production of vaccines better than before? And I suspect that many people, apart from our panel, you know, we barely have an O level in biology and chemistry, but yet we've all can speak very authoritatively on stuff we don't know. But has it really? And I appreciate what Dr. Zubaru said, but has it come around too quickly? If any of the other panelists, Professor Canunga and Dr. Danzo, yeah.
Yeah, I can make a start on that. You're absolutely right. The vaccine has been developed very quickly, and it is record time that within 10 months we have gone from preclinical trials and run through all the 3 phases without compromising the safety checks. So the vaccine indeed has been developed very quickly. But what has necessitated or what has facilitated that is a combination of a range of things. The first one is money has been thrown at this. The impact of the pandemic on the economies and on disrupting people's life has been so significant. We've also known that the pharmaceutical industries did not start from scratch. So we know a few years back we had SARS, we've had MERS, and work was being done in the background on similar types of diseases. And then we also know that the recruitment of people who participated in the trials was unprecedented. Many of the drugs that we use today have had trials done on a fraction of what we have had for this vaccine. And what I can reassure people is that in terms of the safety checks, these vaccines have not omitted any of those safety considerations, and they have been taken all of that into account. So yes, they've been produced very quickly, but that's because of a combination of the resources made available, the production process, but also the level of scrutiny that has been afforded to this. I know people are saying that the trials are still ongoing. Yes, if you go on the register for clinical trials in the US, you will see that it says that this trial will come to an end in 2023. But if people can take time to carefully read that website, you will find the answers there. The US asked for an additional trial to be done on Astrazeneca vaccine, and that was started in August last year. And that is the trial that came to an end on the 16th of March. And yes, when you register a trial, you give a lot more time than what it takes for you to do that. So if people can just analyze the information that's there, the answer usually is in there if they can take an objective view of that information.
Okay, thank you so much. Let me.
Dr. Danzo wanted to come in as well. Did you want to have anything to add?
I mean, I think that's exactly right, and I think the question should be the other way. Why is it that we're not doing other trials as quickly? It should be the other way around, because we can see what happens when money is thrown to certain things and a collective effort of all these different countries working together. So it just makes us think, actually, why has it taken so long in the past, rather than it being so quickly this time round?
Okay, thank you so much. We've got some questions on biodistribution. So what cells of the body does the vaccine travel to? And in which cells is the spike protein manufactured? And also, do we know how long the manufacturing of the spike protein continues? And is it really safe to have this spike protein of this pernicious virus being manufactured inside our cells? So questions around the the biology and the chemistry of this. Anyone? Any answers on that? Oops.
Yeah, so I think this goes back to understanding the basics of biology and what happens when the vaccines are introduced into the human body. And we have a number of infographics which we can circulate, which shows you the basic biology and what happens. And I think the question probably assumes that once injected, this then flows throughout the rest of your body. But the immune response and the spike protein production happens in this case where most of the vaccine is being injected into your muscle. That's where it happens. And then your body recognizes this is foreign, moves in and protects you, and then creates the immune memory. So the assumption that then this then continues in perpetuity is not right and is not in line with the basics of biology.
Okay. Thank you so much. I just want to, before Pastor comes in with some of the chat questions, one query was, in America, the insurance companies recognize that the COVID vaccines are still in the experimental stage, so are not issuing life cover for deaths relating to the vaccines. The question was, are we being experimented on? Any takers on that one?
Yeah, I can make a start on that. I don't think I can speak on behalf of the insurance companies, but what I know is that in terms of the liability cover, because I think there's a separate question related to that. We know we are in a pandemic. Every country has got a public health legislation that enables them to do things that they wouldn't do during peace times. And so the emergency use approval is a legislative and constitutional arrangement that allows governments to bring into circulation treatments that really require or that would save lives. And that is what we have seen. How the industry is interpreting that, I'm not best qualified to comment on that. But what I can say is that the emergency use powers has enabled us to progress so that we can save more lives as quickly as possible.
Thank you so much. Pastor Sweeney, anything on the chat on the vaccine efficacy and safety? Because we have several more questions here.
Yeah, we're not going to get through all of these questions at all. There was one that came through, and it's not on efficacy, but it's a more general question. And maybe Dr. Castrati could begin an answer to this, and others join in. Why is it that the issue of this vaccination, I've never heard any discussion as passionate on the flu vaccination, but this COVID one, it's nearly like Brexit discussions in the United Kingdom. You're either remain or you're out. And it has generated so much heat. And even in our chat, there are very, very strong. Now, I am somewhat, take it or don't take it, weigh up the decisions. But I'm intrigued to know, why is it this particular thing has generated so much heat? I think there's more heat generated from this than actual efficacy of the vaccine. But I'm serious. Why is that, you think?
Well, thank you for the question. I've been following the chat a little bit, and what is happening here really? The world has polarized. Church has been polarized, and it is actually a very dangerous development that we're following here, because we're seeing a split right through the middle of our church. What can we see if we see the chat? We see disparaging comments, we see colleagues, we see health professionals and experts being, not being taken seriously. And everywhere we see the question, where's your evidence? Where's your evidence? The evidence is there. But if the evidence is actually not believed, and if that is already being discredited because it is either promoting financial interests or industrial interests or government interests, then there's nothing we can say. The experts can only share their expert knowledge, which I 100% believe. Why? Because we do have the answers there. So what is really happening here is that the polarization that is taking place is a very worrying development. And again, are we uplifting each other? Are we uplifting our message? And these comments and this polarization and this discussion is not. We have to be aware that we do have a miracle development here. We had a deathly pandemic. We had a pandemic that affected the church, that affected the population like nothing has affected it before. We had lockdowns. We were limited in our movement, in everything in our personal lives. So of course, we were disturbed by this. And of course, we were asking for the reasons why. But turning against each other is not the answer here. Turning towards Christ, that is the answer. So of course, expert knowledge has to be credited and given credit.
Thank you so much. Before we go on to the vaccine contents, I just want to pose two more questions on the vaccine safety. And one is to do with the cytokine storm and antibodies. So reputable scientists, one question came in saying reputable scientists are concerned about the risk of antibody-dependent enhancement. We do have cases, they say, of cytokine storm mounting, and don't know whether this is related to the individuals having had exposure to the COVID virus and then being vaccinated. And they're suggesting at the very least that we should have antibody testing of T cells first. What do you think about that? Is that a fact or is that fiction? No takers on that one. Well, let's go on to the issue with AstraZeneca and the blood clotting. So 17 countries have paused the use of AstraZeneca vaccine due to blood clotting occurring. And one of the professors say, the Norwegian expert says, our theory that this is a powerful immune response most likely triggered by the vaccine has been confirmed. This is what the chief physician, Pal Andrea Holm, says. And they've also gone on to say 3 Norwegian health workers under the age of 50 has been hospitalized. 1 is dead. Again, wouldn't the precautionary principle be to wait until the further risk has been fully excluded? And this is around the blood clotting episodes. Anyone on that?
I'm happy.
AstraZeneca blood clotting episodes.
I discussed this briefly in the slides. Now, it's difficult because, you know, part of it I feel is slightly political. AstraZeneca is made in this country, and when you actually look at the numbers of people who have had blood clots after the vaccine, it is a very small number, and it cannot be directly related to the vaccine. The risk of having that, looking at the numbers, is so small compared to things like, as I said, a long haul flight or the period after you give birth. It's just people manipulating the numbers to fit. The types of people that are having these vaccines, the priority groups that I've shown you, what's there to say that they wouldn't have had the clot anyway without the vaccine? And you have to bear that in mind and look at all the figures. And we also have to look at what's published here. I mean, you've showed us that this was a statement that was made. It's gone off the screen now, but was it a Norwegian expert?
Norwegian experts, yeah, number 11.
UK experts that have said differently. So, yes, you know, we have to kind of be really fair with how we're taking information, because if you plug information from different places, it will fit whatever narrative you want it to fit. Yeah. So we have to also be quite responsible with what we're actually putting out there too.
Yes, yeah. It's just that out of in terms of the 100 and something questions I had on vaccine safety, I think 45 of them was about the clot. So I thought it was important to just really re-emphasize and answer the questions again, because these are the questions that are coming in. Let's now go to vaccine reactions. Now, I know, Dr. Castrati, that you did mention about the yellow card and reporting, and people have gone onto the government websites and they're looking at the reactions for the AstraZeneca and the Fisa vaccine. You can see some figures there. And this list of reactions that I also went onto the website just to make sure I wasn't, proliferating some of these issues. And you can see there, and I did ask people to take a picture of the screen so they can go back and go onto the government websites themselves and check. So we have this list here of vaccine reactions, which has been circulated and which has been on the screen. Can we just have a little bit of comment about, yes, there are, the majority of people, as you've said, have slight reactions, but in terms of the government page on the government website, in terms of the reactions that has been listed there, are there any comments about that?
Well, first of all, I want to say the word reaction is already a very difficult word to talk about, because whether or not the listed conditions here are reactions, that has not been investigated. So it is important to say, yes, this has been published. People can report literally anything on that app, which is good because that will trigger investigations and flag certain phenomena that are happening in a timely relationship to the vaccine. However, only the investigation will show whether those are reactions or conditions. So again, these things happen, but whether or not they're in actual causal context with the vaccine, that has to be investigated first. So these figures are important, they're transparent, they help me to trust the public, the public and government guidelines better because it shows me how transparent they are. But again, I have to be aware that the actual investigation has happened in the trial. And of course, we have to be aware to another correlation. More people are getting vaccinated, so more reports are going out. So again, correlation is not the same thing.
Right. Okay, thank you so much. We're going to skip the risk of an anaphylaxis because
Sharon, I think Professor Canunga wanted to come in.
Oh, lovely. Go ahead. Go ahead.
So, no, just to highlight that the yellow card scheme is a notification system. Mm-hmm. So the numbers you have are the number of times people have used that facility to notify that I have had this reaction. Mm-hmm. However, every one of those notifications is then investigated to say, is this directly related to the vaccine? Absolutely. And if there is, then the precautionary measure that people were calling for actually is utilized. Yes. So you will see that in Europe, the precautionary measure was to stop using the vaccine until that was clarified. And when that was clarified, then the vaccine is now continuing to be utilized. So yes, they are big numbers. Yes, they are frightening. But again, I would encourage people when they go on any information, read it objectively and understand where is this coming from, or at least ask the professionals who are working in those fields, then they can explain, because those numbers, they do look scary, but I can assure you that they've been investigated and have been seen to not be linked with the vaccine.
Thank you. And I think that investigation does give people a little bit more of a confidence that it's being looked into. Now, we've got to move from reactions. I need to go straight into the vaccine contents. We talked about the mRNA. Now, so let's go to the Pfizer. The mRNA is in the Pfizer vaccine. Someone has said, these are the questions coming in, are experimental. Although mRNA has been used previously as a treatment for various diseases, it has never been used in vaccines before. Therefore, the Pfizer vaccine has been considered by some scientists and doctors as more of a treatment than a true inoculation. Is that fact or fiction? I'll go on to number.
That's not a fact, and I would want us to go into the debate on what is an immunization and what is a treatment. But these vaccines are vaccines; they are not treatments.
Right.
Okay, Dr. Abdul was going to come in on that as well, Sharon.
Okay, sorry, I can't see the faces. I'm just using the screen.
No worries. So I'll just jump in.
Yes,
I don't mean to be rude.
No, please do prompt me, Pastor. That's why you're there. Thank you. Dr. Abdul.
Yeah, and it was just to say that I agree that mRNA vaccines are a new technology. And mRNA as a treatment is not new. It's been used for 10 years in terms of treating cancer and things like that. But mRNA vaccines are new, so I can understand people's worries, but the vaccine is very specific. mRNA treatment is very specific, and people worry about obviously adverse effects, but the vaccine, it's very specific. It enters into the cell, but will not enter into the nucleus. And I think the big worry for people is that it's affecting people's DNA, but mRNA technology will not enter your nucleus.
Thank you so much. Let me go on to number 3. A respondent had sent this in. I was alarmed when my wife returned home from taking the Astrazeneca vaccine to find the following stated in its content. So she had the drug sheet with her, where it says in the contents of the AstraZeneca, recombinant, replication, deficient, chimpanzee, adenovirus vector encoding the SARS COV2 spike glycoprotein. And this was also on the government website that you can see here. And the question was, why are they using animal products for humans?
Well, if you don't mind, I would like to take this one because it does go into this a little bit. Is it a clean or is it an unclean vaccine? Now, when we look at genetical material, what are we made of? What are potatoes made of? What are chimpanzees made of? What are we made of? It's those 4 building blocks of life. It's those nucleobases. They're called thymine, cytosine, guanine, adenine, and uracil. And it's those 4 building blocks that are in the vaccine. Now, of course, this genetic material, those bases, yes, they exist in every living organism. But does that make them unclean? I think not, because the tissue out of which those 4 building blocks are taken is not in the vaccine. So whatever is in the vaccine is the genetic material, but no animal tissue, no human tissue. So if we have Legos and we need to use those Legos to build something, it doesn't matter which box we're taking them out of, because in the end, we're using the Legos. But from the biblical point of view, of course, a vaccine is not food. A vaccine is medication and saves lives. So, of course, while there are biblical instructions to forbidding the consumption of unclean food, that does not apply to vaccines at all. And of course, as Jesus himself said, whatever goes into us, it does not have the power to contaminate us, but whatever comes out. So again, spreading false information is much more damaging than a vaccine can be.
So it's just that I think that people were alarmed to see the word chimpanzee there. And obviously you've explained that it's not the actual tissue. Can I just quickly ask these 2 questions on the vaccine content, because we had about 60% of people asking these 2. I'm very concerned by what I consider to be a very controversial content in the Astrazeneca vaccine. Under section 6, it states, produced in genetically modified human embryonic kidney, HEK 293 cells. And they say, I've watched several news interviews and documentary where both the government and health professionals were asked if aborted fetus were used in the production of the vaccines. On every occasion, we were told no. And they've put here, the government has lied to us. Is that a fact or a fiction? And can you explain what the cell lines are? Because some people have felt that this was embryonic tissue, but the key wording there is, from what has been explained by some scientists, are the embryonic cell lines. So people are concerned about the morality issues of ethics with the word embryonic kidney cells in the Astrazeneca vaccine.
Yeah, so I can respond to that, and I'll tie it in with the previous one regarding the chimpanzee adenovirus. And I think just to make it very clear to people, the word chimpanzee adenovirus does not mean it's chimpanzee tissue. It's an adenovirus that predominantly affects chimpanzees. And when you're looking at the vector vaccine, you're trying to find a virus that is relatively safe. So the reference to chimpanzee is not that there's chimpanzee tissue. The chimpanzee reference is to a type of an adenovirus rather than a chimpanzee cell. In terms of the use of human genetically modified human embryonic kidney cells, that is true. The development of vaccines requires you to grow the virus in cell lines or in cell tissue. Now you can do that in artificially created environments, or especially for vector type of vaccines, they do very well in human tissue. Now the HEK 293 cells are cells that have their origin in an abortion that was carried out in the 1970s. And so, yes, is there a moral issue regarding that? Yes, there is a moral issue, but those cells have been grown for many successive generations. The words genetically modified are words we use in day-to-day language, and sometimes it's quite easy to misinterpret them. These cell linings are, yes, from aborted fetal tissues, but they have subsequently been grown over many generations and they've been used to produce the virus to replicate it in order for you to develop the vaccine. There is a moral issue there, but it's not that people are using active abortions now. These tissues have been used for creating other treatments that we continue to use and have accepted. So it is not a new issue. It is an issue that has already been there and it has been dealt with. And obviously this has now been brought to light because everyone is looking at all the information there is about this vaccination. So yes, the embryonic kidney cells do have their derivative from fetal cells, but actually when you are doing the production of those vaccines, you do not include cell material within that. They are just used to produce the virus to enable you to then harvest, literally harvest it away, clean it up, and then use that for your vaccine. So there are no fetal cells in the vaccine that you receive, but has the virus been grown in those cells? Yes, they have. And yes, agree that there will be moral issues with regards to that, but that also is not new. It is related to other treatments that we have embraced.
Thank you so much for that explanation. Can I just finish with this vaccine content with this question? Under section 6 of the Astrazeneca vaccine listing the content, it states, this product contains genetically modified organisms. And it says, the inquirer says, when I go to the supermarkets, I always check the products carefully and never knowingly purchase anything considered to be genetically modified. Why should I then accept vaccines with GMO when I'm suspicious of the harm it could cause my body? Any responses on that?
I mean, I'm quite happy to answer generally. I think first and foremost, I just want to say that, you know, we are here to give information. It is ultimately a personal decision whether or not you take the vaccine or not. So that's just important to point out. If you do not want to have the vaccine, you do not have to have the vaccine. But we're here to just explain everything that's there as best as we can. And so what I would say with regards to that is the information is there. If you want to find out exactly what's in the vaccine, it is all there. As I said, I work in the COVID Hub Centre. I answer lots of questions that people have about what's in it and everything else. But this is all an individual thing. If you want that information, it's there. So the question is, should I have to accept the vaccines if you're suspicious? No, you don't. You don't have to. You just have to. All we're here for today is to give information so that you can make an informed decision about whether or not you'd like to have the vaccine. And I think that's just it ultimately, because I've seen lots of things in the chat as well. And, you know, I don't want to, you know, people have, you know, coming here to give information and, you know, giving up their time to speak about this because it affects our community. And I just don't want anyone to feel discouraged or anything else like that. So I felt necessary that it's important to mention that there.
And this is why we have had health professionals to answer the questions that are troubling individuals and causing hesitancy. So we do value your presence here today. Now, I just wanted to ask some ethical questions. Pastor Sweeney, is there anything on the chat that you wanted to? We're going to have to just take one question from each of the other segments now because we don't have...
our time is going to be going soon, right. And we are going to finish on time. But right. I think we do need to do some signposting, Sharon, and
yes,
and also to offer thanks to, and I think, are we going to take the poll again
yes, in a minute. Can I just ask people to just take a picture of these screens then, because they would need to get back to the health professionals with the questions. So sure, ethical issues, as you can see, informed consent, children. I just asked this one very quickly. There is such a tiny risk of children getting this virus. These vaccines are now being trialed on children, and we are being told children will probably receive the vaccine in August. Is it really right to roll out a vaccine in trial to children when the risk for them of COVID-19 is so very small? Can somebody answer that very quickly before we go into the summation? Thank you.
I think a very quick response is that rollout of vaccines in successive cohorts will be subject to the same level of scrutiny as we have seen with these vaccines. So if we get to that point, it means that all of those considerations have been taken into account and that the safety of children is always a priority.
Lovely. Can we just take a very quick picture of the religious views, the screen questions there? We don't have time to go through that. So just a quick picture of those questions on religious views, and then vaccines and liberty. I need to ask this one very quickly. There are discussions around about pubs asking customers if they have had their vaccine, and this would determine whether or not they enter the building. Will the SDA Church be asking its members if they can produce evidence of having had their vaccine before letting potential churchgoers access the building? And very quickly, will we have our jab to enter the church building? And is there any other alternative for those who don't take the vaccine, i.e. testing?
Well, I can't speak for church leadership here. So Pastor Sweeney will be better equipped here to give that answer. But of course, well, what is happening here is nobody is forced to take the vaccine. Yes, of course, we're strongly recommending it, but we're not forcing anybody. We're just asking people to look out for each other, to keep each other safe. So whoever does not want to take the vaccine, of course, we're going to ask to put the measures in place to keep other persons around them who might be vulnerable to the virus safe by wearing a mask, by adhering to the recommended public health measures, of course.
Thank you. So at this point, we're going to have to do a closing poll, and then we're going to invite, while the questions for the closing poll is up there, did you answer all the questions? Were there some questions not answered? Or whether you're more informed? Can I just introduce Dr. Sherilyn Perry, who's going to give the summation. Dr. Sherilyn has over 15 years working in clinical drug development, specifically as a clinical pharmacologist. She's currently works as a principal regulatory consultant, providing scientific and strategic support to pharmaceutical and biotech companies. Dr. Perry, the time is yours just to give a summation of what you've heard so far.
Okay, thank you, Sharon, for that introduction, and to our panelists who gave very informative presentations and really addressed the pertinent questions that were posed. And I think that the questions really did cover certainly all the questions I have heard over the past 12 months in regard to the vaccines. And the questions that came in ahead of these presentations and during I could see on the chat really could be bucketed into several categories. So either vaccine efficacy, vaccine safety, vaccine reactions, vaccine content, and then there were questions around ethical issues around the vaccine and our faith, and issues of vaccine and liberty. And so just to quickly summarize, because we're really running out of time. So around the question of is about the vaccine efficacy, and we can definitely say that the vaccines have proven to be effective, especially in the initial trials. So as we heard that in each of the individual products, over 40,000 people participated and good efficacy was shown. And subsequently, there have been additional trials. Certainly for the Astrazeneca, there was one that just completed in the US. In Israel, they've also shown good efficacy with these products. So that certainly is factually correct. With regard to vaccine safety, I'd just like to say that actually we're in unprecedented times, and I've worked in clinical development. I've reviewed safety of many products, and I can say that we haven't had pharmacovigilance on any products as we have with these vaccines, and it has been tremendous. Everything. So when we see the data that such as was presented, correctly was said that that every potential side effect has been documented, especially if they've been registered via the yellow card system. They will be documented and evaluated for causality to the vaccine, and that is correct. With regard to whether or not the the testing of these products was too rapid. The clinical trials occurred too quickly. I personally did sit through the AdCom boards that the FDA had for Pfizer and Moderna, and have listened to what the European Medicines Agency had to say about the other vaccines, and have been trying to keep up to date. And I can say that they did not miss out on any studies. So the only thing that's lacking now are the long-term trials, as the long-term safety data, and that was brought out. But they did conduct all the clinical trials, and they did it in an expedited manner. So normally you'd have the studies will be conducted sequentially, but what we had were overlapping studies. So that's why they were able to expedite these clinical trials, but they didn't miss out on any of the safety trials. So I can certainly reinforce what was said there. So just moving on. So if we also looked at the questions on about the biodistribution, whether that was whether that the vaccine goes to other cells and it causes problems in other parts of the body. And the professor was able to confirm that's fiction, that most of what happens is in the muscles where the vaccine is actually given, and you don't have the spike protein just produce infinitum. So that was what was said. And also about the liability in different countries, how if something goes wrong, why is it that the different, if you needed to sue the pharmaceutical companies, you can't do that. And many of the countries, the governments have decided that they will underwrite any possible issues there. So, and there's legislation in place which has actually permitted the progression of these vaccines to be available as quickly as possible. And so I think what was highlighted also was that what's also permitted this to occur is that, the money has been, the large pharmaceutical companies have come to the assistance of, like for Pfizer. So we call it the Pfiza vaccine, but it wasn't Pfizer that developed the vaccine. It was biotech. It was a smaller biotech company, and they needed, because they can't do the scale up, so they approached Pfizer, and Pfizer then provided the facilities and so forth to enable that to happen. Also, what's happened with the economy has also driven this expediting of the production of the vaccines. We heard that the pharmaceutical industry did not start from scratch. So they have been developing these mRNA technologies for a while, and it just so happened that everything came together in such a way that they were able to really modify what they do to actually develop a vaccine. And we've had recruitment. So is usually I have to say, if you work on clinical development programs, recruitment is always an issue, but because of maybe a certain amount of fear with regarding the virus, recruitment was unprecedented. People did volunteer to be vaccinated for various reasons, and there's been unprecedented scrutiny. So we are more aware, and there's more transparency around the vaccine and all the issues than ever before. But with regard to safety, if you think about it, I looked at the numbers before this meeting, and over 500 million people around the world have been vaccinated. And so when you have 500 million people being vaccinated, you will expect to see lots of events. Maybe some of them are coincidental, some may be related, we do not know. But as time goes on, we'll appreciate more what is directly related to the vaccine. And with regard to the issues that we've seen around blood clotting and Norway, that's actually interesting, because Norway as a country seems to have had, they have highlighted more incidences of certain things than any other country. So we don't know exactly what's going on there, but we know that, as highlighted by one of our panelists, that actually the incidence of blood clotting is very rare. You know, if you relate it, compare it to what happens if you fly, or if you've had a baby, or if you've been on a contraceptive pill, the risks are extremely minuscule. And obviously, if you're going to vaccinate that many people, you're going to see some of these things, and it unlikely to be related is what I was hearing. And in further summary, so we looked at, I already touched on the pharmacovigilance. So I think one of the questions highlighted the total number of sort of reactions and reporting as a result of the yellow card scheme related to, I think it was, this one's the, I think it's Pfizer or Astrazeneca, and the numbers look very large, but we, as was highlighted, that these include everything. So every kind of reporting, and not all of these have been investigated. And so that's the take home message, that when you see numbers, you have to ask, you know, are these just everything that's been reported? Has it been the causality actually been proven? And I think with this type, you would not normally see this sort of reporting for other medicines, to be truthful. So this is unprecedented. And actually, some of you may have seen there was an advert put up by the MHRA where they're asking for people to report everything. And so this is what you're seeing, is the reporting of everything and anything.
So in conclusion, I'm
So
sorry
in conclusion, sorry, there was a lot that was said, so it's a lot to summate. But so in conclusion, I'd just like to say that I think it was highlighted that we have to be very cautious about what the message, what we receive, and what to believe. So there's enough out there. You can find out what's truth very easily, in the same way as it's easy to find out what's fiction, because a lot of people just send you things. And I think one of the take-home I have is that before we share anything, we have to decide, am I uplifting Christ? Am I uplifting my fellow brother and sister? Am I using these informations correctly? Am I certain of what I'm receiving and passing on? And am I showing a duty of care to my fellow brother or sister? And I want to thank each of the panelists for sharing their knowledge and expertise. I found it very interesting. I learned some things from it as well, and I'm sure you have as well.
Brilliant. Thank you, Sherilyn. People are asking for your details. Can you put any details in the chat if you would like to be approached?
I can. I'm on LinkedIn, so I can put my details in the chat.
I'll leave you to do that now while Pastor will give the final comment. But I just want to also convey my appreciation to every panel member. You've all been fantastic. We value your time, your expertise. And, you know, some of the questions were probing, but these are the concerns. We have to respect that people have concerns. And so we have to raise these questions that have been asked. And thank you so much for answering them in the time we had. And we do hope that those questions that weren't answered, that people have taken a picture of the screen with the questions, and we'll be able to meet some of those queries subsequently. And Pastor has agreed to do another one of these events, and we'll wait and see what that transpires. So Pastor, over to you.
Thank you very much. And I do want to thank all of our panelists, Dr. Zubairu, Dr. Danzo. Thank you so much. I know you're very much on the front line in your practices. Appreciate that. Professor Canunga, thank you for helping protect the health of the folk in my home conference in the North England. And Dr. Castrati working in my home conference. Really appreciate. And of course, Dr. Perry, thank you for that summation here at the end. We really do appreciate it. And we will be having another event of maybe this kind or a little bit different. There are so many questions, so many things to answer. And, you know, I've seen people saying, oh, you know, is this emotional blackmail and so on. I think Dr. Zubairu, Dr. Danzo said it very clearly. You make your own decision. If you want to take it, take it. If you don't, don't. Talk about it, pray over it if you are of faith, and get on with life. But one thing, for me, it is not Brexit. It is not something I'm losing sleep over if you don't want to take it. I love you if you can love me for having a vaccine. Amen. The Lord said in the Christian faith, love your enemies. I had the vaccine. Is that emotional blackmail? I don't know. If you don't take it, I love you all the same, but I'm not going to hug you because I'm trying to protect myself. So I would say if there is a vaccine that we could have for some folk just to chill a little, take your time, read the things. You know, I've been married to a woman 34 years. I disagree with her on so many things, and I can still love her. And I'm going to love people who may take a different attitude to taking the vaccine. And that's as much as it is. But really do thank our panelists. It really has been enlightening. We are going to do something like this again, bringing in other folk as well, and allow you to make the decisions for yourself. And somebody asked, will the church enforce it? The Seventh-day Adventist Church has been a proponent of freedom of conscience, freedom of liberty. We will defend people who don't believe as we believe. And that happens with religion, and it happens with vaccine. And so no, the church will not promote freedom of conscience and then force you to do something you're not, or you do not want to do. So just we'll leave it at that. But thank you all so very much.
Sorry, Pastor, to interrupt. The poll, what the poll results people are asking for is has Pastor Richard Daly got the differentials? Yeah. Who's going to interpret those poll results? Were your questions answered? I think most people said that their questions were answered. Yes, we did have 10% of people whose questions were not answered simply because there were so many on the chat. But if you've taken the photos of the screen with the questions on there, you will be able to get those questions answered subsequently by our health professionals. So we do apologize for going over time, but this was a really important event, and we wanted to give people as much time as possible to ask their questions and the presenters to answer them. So thank you once again. Pastor, the closing.
Thank you. We're going to close in prayer. And again, thank you so much. Almighty God, we thank you for your watch care. We thank you for the giftedness and the education you've placed upon people, upon our doctors, upon our scientists, upon our public health professionals, and so many others who wrestle and deal with so many challenging issues, particularly as we face them during this pandemic. And we pray that you would grant to us all wisdom, and we thank you for the freedom of conscience to practice and to believe, and may whatever we do be in the best interest, not simply of ourselves, but of our wider community as well. And so thank you. Be with us now as we part from this Zoom space and into the care of our family and friends. We pray in our Father, in the name of our Savior, Jesus. Amen. Thank you all. Wishing you God's blessing. Have a great rest of afternoon and evening.